Hi everyone, and welcome to the third and final webinar in this series on social accountability in the delivery of social protection. This webinar series is organised by HelpAge International and the International Policy Centre for Inclusive Growth, and it's hosted on the socialprotection.org platform. We've had two webinars prior to this, and the recordings and presentations for those can be found on the virtual campus or accessed by the social accountability community on the socialprotection.org website. This final webinar today is looking at some of the enabling factors which support social accountability processes in social protection. So we have three speakers today. We have Isabel Fry from the Studies in Poverty and Inequality Institute in South Africa. And Isabel is going to be talking about the legal and policy frameworks which support social accountability. We have also Tabitha Hrynik and Linda Waldman, who are both coming from the Institute of Development Studies at the University of Sussex in England. And they will be giving a joint presentation on the role of technology in social accountability and sharing their experience from the health sector. We've got about 40 minutes of presentations, followed by another 40 minutes or so for questions and discussion. We will take all the questions after the two presentations have finished, so you can submit your questions at any time by typing them in the chat bar, or you may wish to wait until the end of the two presentations before submitting them. If your question is specifically for one of the speakers, please indicate who it's for, along with your question in the chat bar. And unfortunately, Isabel needs to leave us a little bit earlier. So if you do have specific questions for Isabel, then make sure you get them in early. Okay, so let's have a few introductions before we go to the presentations. So if we can have the next slide. So my name is Alice Livingstone. I'm a social protection advisor in the global technical unit of HelpAge International, and I've been working in the area of income security for about 10 years. And in the last few years, I've focused more on voice and accountability in social protection, including processes such as older citizen monitoring and grievance redress mechanisms. Next slide. So our first speaker today is Isabel Fry, and Isabel is the director of the Studies in Poverty and Inequality Institute in South Africa, and her research focus is on poverty, socioeconomic rights and social protection. She's also involved in other roles, including as a member of the Council for the Advancement of the South African Constitution, or CASAC. She is a board member of the Open Democracy Advice Centre and the board of the Southern Africa Social Policy Experts Network. And she is also a representative of the Financial Sector Campaigns Coalition. She has a background in law and previously worked for the National Agency of Labour and Economic Development Institute and as the National Advocacy Manager for the Black Sash in South Africa. And next slide. Tabitha Hrynik is a research officer in the Health and Nutrition Cluster at the Institute of Development Studies, and she currently works with the Interdisciplinary Zoonosis and Emerging Livestock Systems Initiative. And before that, she worked with the Making All Voices Count program to help build the evidence base around what works for social accountability in health systems. And she's also worked with Gender Insight on women's leadership in international scientific collaboration for development. She obtained her MA in Development Studies at IDS in 2016. And next slide. And Linda Waldman is a research fellow also in the Health and Nutrition Cluster at IDS. And her work has focused on the diverse dimensions of poverty and the related issues of gender, racial classification, ethnicity, and identity. She has also conducted research on farm workers, gender, environmental policy processes, health and social housing, and aid architecture in Africa, India, and the UK. More recently, she's been working on mHealth, including its potential for enhancing social accountability and health outcomes. And Linda holds a PhD in anthropology from the University of Witwatersrand. Okay, so I would now like to hand over to Isabel for the first presentation. Thank you, Isabel.
Thank you very much. And thank you very much for the invitation to participate in this webinar. Sorry, I'm just hooking myself in, so hopefully you'll be able to hear me all. Great. So you've got the slides in front of you. And just by introduction, as we move to the next slide, I work for Studies in Poverty and Inequality Institute, and that is a not-for-profit research organization which is based in Johannesburg in South Africa. What we try and do is to, through research, generate information that can be used for advocacy and lobbying around the reduction of poverty and inequality, with a specific emphasis on socioeconomic rights. And we have a flagship program which we refer to by the very long title of Monitoring the Progressive Realization of Socioeconomic Rights. And that really does talk to the question of social accountability for socioeconomic rights and social protection. And just as I take you through my presentation, one of the real challenges that we had is that while South Africa has justiciable socioeconomic rights within our constitution, the question was how those are monitored to enable civil society and other oversight bodies to actually hold the state to account in terms of the rollout. And I'll speak to the question of progressive realization as we move through. Next slide, please. Next. Thank you. So the presentation that I'll be taking you through looks at, just very briefly, names the accountability frameworks that we have. And then I unpack the three-step methodology that we've developed for monitoring socioeconomic rights. And then very briefly, and that's really for participants to look at leisure, show examples of the methodology in practice, specifically looking at the budget analysis and the indicators through the work that we've done on basic education in South Africa. Next. As I was mentioning, within South Africa, we have a very progressive constitution that was adopted in 1996 after the end of apartheid. That constitution, in terms of sections 25, 26, and 27, and 28, contains what I referred to earlier as justiciable socioeconomic rights. We have recently also ratified our acceptance as South Africa of the United Nations ICSCR, International Covenant on Economic, Social and Cultural Rights. That was after quite a delay. It was signed by former President Nelson Mandela in New York in 1994, but the state delayed in ratifying it for a significant period of time. And in terms of reasons for that, our constitution was much more progressive and we didn't really need to, but there've been interesting developments in terms of that. And South Africa, at the end of last year, lodged our first socioeconomic rights report to the Council. And in fact, we will be in September before the Council for the state to respond to that. And then other rights appropriate documents, which you'll see in the presentation, which I refer to education-specific documents. So really, for us, the question of accountability comes down to the critical criteria of the right of access to socioeconomic rights, to begin with. Secondly, the question of progressive realization, how we measure that, the question of the sequencing of the move from targeted towards universal, which is what our constitution refers to. And of course, the flip side of that is the maximum available resources that are available in order to meet the socioeconomic rights. And I think that's a very topical question, as is the question of universality globally right now. Next. So when we started looking at how socioeconomic rights could be could really be sort of implemented and monitored by civil society, what we did was we developed a 3-step methodology. Subsequently, actually, well, in parallel, we discovered that there was a lot of similarity between this and the CESR in New York's OPERA framework. But this was really done quite organically with the questions that raised themselves and our answers to that. So what we've done is we've divided up into 3 steps. Firstly, the policy analysis, secondly, the budget analysis, and thirdly, indicators. So in terms of the policy analysis, looking at line departments, policies as well as frameworks, our question is to what extent is there evidence in the policy adopted by the state and implemented by the state of a move towards universal realization. The second, in terms of the budget analysis, is we ask the question, to what extent is money made available for the rhetorical kind of policy commitments? And so in terms of that, we look at budget allocations at a national level. So how much money is being given, and is this progressively increased between line departments, but also within the programs selected by the line departments to realize the rights and the aspects. Is this increased substantially, and is it done in terms of the policy commitments themselves? One of the things that we find in South Africa and possibly many other countries is that while you might have adequate allocations, the actual expenditure by the implementers leaves a lot to be desired in certain times. So we've also started tracking that, but our main emphasis is on the state's allocation and resources. And so that's really the kind of input, the supply side by the state. But we also thought it really important to ratify the enjoyment of it. And so what we've done is to develop 3 indicators on 3 dimensions, namely access, adequacy, and quality. Now, we're aware that globally there's a lot of work that has been done on indicators, and many use the 4 A's or the 3 AQ. But for our purposes, as will be explained, these are the ones that we find best in terms of not having an overwieldy mechanism, but one that gives sufficient sense of what exists. We were very clear in the development of our indicators. We started off with a dream list for each right, but we need to ensure that the indicators have a publicly available database in terms of which people can see and read the data, and that we don't get into kind of arguments with the state as to whether or not our sampling, etc., is the same as theirs. And so we use Statistics South Africa data in terms of meeting and reading the indicators and populating them. Next slide. So just continuing the question of the indicators, we started developing them, but firstly by looking at the literature and the jurisprudence that's been developed around the core content of each right. Then we looked at the existing reporting mechanisms and indicators for the right that the state has used. As indicated, we developed an ideal wish list of indicators for the right. Important in each of these processes has been the involvement of larger number of stakeholders, both sectoral content experts, often academics, civil society organizations, including organized labor, and government partners, so that it doesn't come out as sort of a parachuted in analysis, but that the role players themselves are part and parcel of the exploration of what we're trying to do. And then the identification of the indicators. As I've said, under 6, the criteria that we use in red is data available annually, ideally, and is data disaggregated geographically and hopefully by income group, by gender, race, and age, to highlight inequality of access to socioeconomic rights. And then we feed that back to the stakeholder group, and then finally come up with a set of indicators and populate those with the data. Next slide. As mentioned at the beginning, the illustration of this presentation will use the work that we've done on the right to basic education. That's the slide in front of you beforehand. So starting with the step 1, the policy analysis, we look at the framework documents, as mentioned. That's the Constitution, national and provincial legislation and regulations, and reference is made then again to the international instruments that pertain to that right. In this case, the Universal Declaration of Human Rights, the ICSCR, the UN Convention on the Rights of the Child, as well as Article 11 of the African Union's African Charter on the Rights and Welfare of the Child. One of the things that we found is important in order to get buy-in to our analysis is the need to have it locally applicable, and hence both the African Union and SADC, the Southern Africa Development Corporation's treaties, are what we may pay reference to. Next slide. So if one looks, for instance, at the Constitution, the South African Constitution, in Section 29.1 says that everyone has the right to a basic education and to further education through the state, which the state, through reasonable measures, must make progressively must make it progressively accessible. So Section 7.2 of the Constitution guarantees that the state that must both respect, protect, promote, and fulfill these rights to a basic education. So that goes beyond the ICSCR and the conventional aspect of respect, protect, and promote. Our state has a very positive obligation to actually fulfill the content and the enjoyment of these rights. Next. As I mentioned, part of the issue, part of our methodology on the policy analysis is to look at jurisprudence. And so there we have, it should be coming up now on the next slide. Our Constitutional Court has been very active in terms of the social rights. And so by the Constitution, the court ruled that unlike some of the other socioeconomic rights, the right to education is immediately realizable. There's no internal limitation that the right be progressive available resources to reasonable legislators. And so what we can see there is the rights we can relate to our accountability. Yannick, I'm just concerned that we seem to be following on to the side. So we now need to skip 2 slides down to the question of basic education content and obligations. Okay, I'm going to switch off my camera. Costi, are you reading the notes? Mm-hmm. Wrong one. Okay, hopefully your audio is better. Right. Okay, so I'm conscious of the time, so just to look quickly at how, for instance, our legislation has identified aspects within our indicators such as high quality. So basically in South Africa, we're very cognizant of the racial divides of apartheid. So in order to address past injustices, the state must lay a strong foundation for the development of all our people's talents and capabilities. And so participants can read through the directives for the policy analysis in terms of the jurisprudence that's handed down. So if one looks at the UN Committee on Economic, Social and Cultural Rights General Framework, this is 2 slides down from where we are right now. The 4 A's framework that I made mention of: availability, accessibility, acceptability, and adaptability. There's specific comments that have been made around that as it pertains to education. Yannick, I think you've gone in the wrong direction. We need to, can you move on to 3 slides? Next one, next one, next one, next one, next one. Next one. There we go. Thank you. So again, bringing the rights together, we can see that there's an interrelation of rights for South Africa in terms of the constitutional obligations. We marry the fundamental rights to equality, human dignity, freedom of religion, belief and opinion, freedom from unfair discrimination, together with Section 29, which has the rights of the child, Section 28, sorry, the rights of the child, and Section 29, the right to receive education. So it's really important when you are trying to promote accountability to marry both what is there in terms of legislative frameworks together with some of the particular laws and the Constitution and international frameworks. Next slide. So the next slide talks to the question of what goes into the kind of contents and obligations. Those include high standards of professional ethics, the effective use of resources, the fact that public administration must be development-oriented, services to be provided impartially. Next slide. People's needs to be responded to. So this talks to the participation in the policy making, as well as the accountability of public administration and transparency and good human resource management and use there. And so if you move on to the next slide, we look at questions, the obligation to use maximum available resources, the need to look at adequacy, equity and priority, efficiency and effectiveness. And so if you move on to the next slide, slide 17, we then apply this in terms of the budget analysis. We look at our 3 tiers, which is basically national and provincial, as well as the local government expenditure. And we track that over time so that we can have a trend analysis as well as an immediate analysis. We break down between personnel and non-personnel expenditure. And in order to assist people, we generally try to convert nominal amounts to real amounts so that we can see, as the next slide demonstrates, this gives us a richer ability to be able to track. There we have nominated basic education allocations and also the percentage of change. So the graph that you should have before you can show from the years 2005-6 to 2016-17 the nominal allocations. There we use nominal allocations because we give the rate of nominal change as well. Are we able to get onto the graphic slide? It's slide 18. There we go. Thank you very much. So you can see the bars there indicate the nominal allocation, and the dotted line, the green line, can track as well the amounts of change in terms of allocation. So that makes it easier to see the difference in terms of nominal amounts. Next slide. Some of our research also takes us back then to the question of the differing allocation by the state in terms of meeting its obligation. So you can see there that while we have a progressive increase in terms of nominal, sorry, the amounts don't seem to, the slide doesn't seem to have traveled well. But anyway, and at the top you can see that line that shows, sorry, the percentage of basic education allocation in terms of total government expenditure. So we can see, as we move to the next slide, please, how through this program what we're able to do is to use the available data in order to track and to show government the exactly how their performance is done. So there we can also see that South Africa, how we rank comparatively globally in terms of allocation. What we found is that it's really important not only to look internally, but also to look globally. We've had many conversations and done some collaboration with New School University in New York with their SURF index, which looks at Socioeconomic Rights Framework Index, and that assists in terms of comparing government allocations. So there are a number of slides that continue. I'm just aware that we have other presenters as well. So I think that what I'm going to do is just to sum up. In essence, it's critically important. So we're not going to use any more of the slides. It's critically important to have some kind of accountability framework. It's essential to combine robust and transparent data analysis together with other textual analyses. We found that it's indispensable to have buy-in and allies, both from civil society organizations, what we call oversight institutions. We've got certain such as the South African Human Rights Commission, Parliament, and we try and spend a lot of time in terms of working with members of Parliament to give them this data so that they have an alternative source of data to hold the executive to account in Parliament rather than just the admin data that the executive gives. And of course, civil society organizations who are able to use this in their own analysis and their own application of submissions to Parliament, but also in terms of having joint submissions. As an NGO, as a civil society organization, we've been able to work very closely with the Human Rights Commission in terms of making our data available to the state, and they used that quite substantially in their reports to the UN Committee on Economic and Social Cultural Rights. And so we found this tool a really useful way in terms of making socioeconomic rights real, and in terms of influencing in a non-politicized way the distribution and the allocation of resources. So thank you very much, and I look forward to the next presentations and to being able to answer any questions.
Great, thank you so much, Isabel, for that really interesting presentation there. I think as Isabel has to go early, what we're going to do is just take a few questions for Isabel, and then we'll move on to the second presentation. So if there's any listeners online who have any questions for Isabel, then please submit them now. And I'll wait to hear from the organizers if we have any coming through. I have a question, which to get things started. Okay, let's see. So at the moment, so I'm just checking what's the information coming from the organizers. So, okay, at the moment we don't have any questions. So, okay, I think what we'll do is we'll just move on to the next presentation, and then we'll try and include a few questions later. What we can always do with questions, and what we have done in the past, is that if we run out of time for questions, or if there's, you know, anything that you kind of thought about later on, we can actually sort of send questions to the panelists afterwards, and we collate them and put them on the website. So even if Isabel has to go, we will find a way to get questions to her. Okay, so I think, yes, what we'll do is move on to the next presentation. So Tabitha and Linda to give their joint presentation on social accountability, use of technology for social accountability in the health sector. Okay, we can't hear you, so yeah, you seem to be muted at the moment. Okay, yeah, try speaking now. We just heard something. Okay, not working. Okay, so let's just, I think, just wait for a few minutes while we see if we can get some sound from Tabitha and Linda. Yeah, we've seemed to be working just before the tests, before we started, but send for technical support.
Hello? Hello?
Yeah, we've got, yeah, we can hear you. We can hear you. Fantastic. Thank you. It must have been the presence of your IT guy who...
Yeah, I imagine. fixes things.
It's physical proximity fixes things.
Yes. Okay, please go ahead. Thank you.
Okay, all right, we'll dive in. I'll try and make up for time as well. Okay, so I'm Tabitha. This is my colleague Linda.
Hello, everyone.
All right, so we are from the Institute of Development Studies, which is a global research and learning organization for equitable and sustainable change. Slide, please. So our research was part of the Making All Voices Count initiative, which funded and helped to guide a large number of innovative accountability initiatives across Africa and Asia. So there's been a considerable enthusiasm regarding the potential of ICTs to enhance citizen engagement and accountability, and so many of the MAVC projects incorporated ICTs in some way. So our paper was part of the research and learning component of MAVC, which sought to flesh out the evidence base around what works for accountability, including what tech can do for social accountability. And Linda and I had a particular interest in mHealth, or mobile ICT-enabled health projects, and noticed that there had been relatively little theorization or empirical observation of mHealth in relation to accountability. So we worked with MAVC to investigate some of the program's health-related projects to do some exploratory work in this area. So the full paper can be downloaded at the Making All Voices Count website. The link is there, which also hosts a large number of other research reports detailing different bits of evidence from across the MAVC portfolio. So if you're interested in reading more about social accountability, the MAVC website is well worth a visit. Slide, please. So we worked on 7 projects, or we had a look at 7 different projects. All of them were led by civil society. 5 of them were in Africa, as you can see here on the map. And the projects ranged by theme from maternal and sexual reproductive health to HIV/AIDS and general health. And they were all quite different in their designs and objectives. They used tech in different ways, and they were deployed in diverse contexts, including both urban and rural settings. We conducted semi-structured Skype interviews with 1 or 2 project representatives, and I'll just quickly gloss over what these projects were. So in Nigeria, we looked at one project called Text to Speak, implemented by Pathfinder. In this one, pregnant women assessed services at prenatal clinics using SMS. In South Africa, we had 3 different projects, including Tutusela Voices, where survivors of gender-based violence assessed rape and gender-based violence services, also through SMS. We had Our Health, which was an organization or a project that paid citizen activist journalists to monitor medical supplies and write stories using tablet apps. And eThekwini Wax was in KwaZulu-Natal. In this project, the HIV community was to report to the government on HIV and AIDS issues and services through a 2-way smartphone app. Over in Tanzania, we had one project, Mobile Mapping for Women's Health. In this project, which was in a very rural area, community members were surveyed by enumerators to assess and map the availability and quality of services using apps on tablets. Slide, please. We had 2 projects in Asia, both of them in Indonesia. One in rural.
Wait for your slide.
Oh, well, yeah, thank you. Okay, there we go. So one was in rural East Java. That was the SMS gateway, in which pregnant women, along with helpers, used an app to communicate about their pregnancies and their needs with health authorities before visiting a hospital, so that hospitals could plan for their visit. In Bali, we had the CJ, or Citizen Journalist Health Insurance Scheme project, wherein citizens were to assess national insurance-related health service quality through social media after receiving one-time health rights and citizen journalism training. Slide, please. So just a quick brief slide on some of the theoretical framing for our research. So we started with the very basic accountability recipe offered by the World Bank, which suggests that accountability for public services such as health requires 5 key dimensions. Firstly, mandates, obviously resources. Isabel spoke a lot to both of those very important key things. Information, so do superiors or perhaps citizens and watchdogs have access to transparent information on whether relevant actors are performing adequately. Monitoring, are there mechanisms to pay attention to this information over time? And sanctions, if there's a problem, is something being done about it? Social accountability initiatives, which stress the downward relationship, accountability relationship between states and citizens, are very often focused on information and monitoring components, and thus there's some assumptions built into them. And these are either that other dimensions are in place, or that through information collection and monitoring by citizens, sometimes through tech, as in our projects, the other dimensions might be strengthened. So focusing on information and monitoring alone can assume that enough political will exists and capacity and resources exist to make necessary changes. In the social accountability literature, we see a slightly more nuanced view, which emphasizes the centrality of power relations, and that improved accountability requires shifting these power relations, and therefore the political navigation of complex landscapes full of powerful actors and interests, which may be highly resistant to change, or at least unable or not incentivized to support it. So to create these shifts, Fox suggested, informed by empirical observation, that mutually empowering coalitions of pro-accountability actors in both state and society, or pressure and willingness from both above and below, is probably necessary for social accountability initiatives to be successful. Slide, please. So that brings us to our key question, which is what factors helped create or hindered enabling environments for social accountability in these 7 civil society-led initiatives? And we structured our inquiry loosely around 3 themes informed by our interest in tech and the processes of integrating tech into accountability initiatives, but also by the suggestion of Fox and others of the importance of participation of both society-side and state-side pro-accountability actors. So while there are certainly overlaps between the themes, we use tech as a starting point and then move on to the others. As a quick caveat and sort of methodological point, any notions of success or failure or what was enabling or not are through the perceptions of interviewees who were intimately tied to each project. And these interviews were also conducted not long after or quite near the end of project cycles, so we can't really speak to medium or long-term impacts. So with that, I'll switch over to my colleague, Linda. So slide, please, and she'll talk about technology.
Thanks very much, Tabitha. So next slide. Thanks very much. So talking about technology. As we mentioned earlier, the different projects used technology in many, many different ways. And while we don't have time to talk about each project individually in depth, most of them use tech in one of the following 4 ways. They firstly remotely solicited citizen feedback, usually through SMS, on health services experiences. Some of the projects used technology to collect data from citizens offline, and this was usually through surveys of some sort. Citizens were trained to use the apps or social media to make reports. And lastly, technology was used to analyze or add legitimacy to large amounts of complex data. Next slide, please. So it probably comes as no surprise to hear that most of the interviews definitely felt that technology added value to their initiatives. And once they got their apps up and running, they reported a number of positives. And these are just some examples of these positives. So you can see, for example, in the first one, the orange one, the purpose of the app was being to create visibility for voice and to create space for voice to be heard. The apps also created value and legitimacy. So in the green one, you can see very clearly, it was very clear to government stakeholders which health centers were performing well. Technology obviously saved time. And so in this particular example, it's about citizen journalists in very rural places. And it says they had to go to FACSIT or to internet cafes, which were very far away. And so the mobile app made this much easier. And in the last example, this is around data management and complex analysis. It was previously you had to go through all the stockout reports and put them in an Excel sheet. And there were so many tabs and so many spreadsheets that it became hard to analyze it. And with the mobile app, it's so much easier. Next slide, please. Okay, so in our paper, we produced these diagrammatic images of all the different projects, and this is in order to try and show how the technology is being used, so you can go and have a look at them. This particular one is for mobile mapping for women's health. So in this example, technology was used in two different ways. Firstly, it was used to collect information from citizens on their experiences of sexual and reproductive health services in the area and on their reasons for accessing these services, but also very importantly, also for not accessing these services. This was done through tablet-based apps, through tablet app-based surveys, which were given to trained community-based enumerators. And given that this was in Tanzania, it was a very rural setting and there was very low ICT ownership, the very novelty of technology itself generated lots of interest amongst the villagers and lots of desire to participate. And that desire was also amongst men and non-users of the services. And in fact, men's interest in the technology created more access for women. The second way in which the technology was used was to digitally map the feedback on various different health service centers. And this was seen as a way of putting data together was seen as being very compelling and very clear. And there was a way of legitimating data and presenting data to government in a new way. So these maps were discussed and shared with community members, with health service providers, and with local government. Next slide, please. So this slide is about some of the technology, the challenges that the projects experienced when doing these projects. So there were quite a lot of there were a lot of benefits that came from technology, but the use of technology was not straightforward. And its incorporation into projects required navigation of new sets of relationships and of unforeseen obstacles. So several of the projects reported having differences in vision and expectations of what was realistic with tech developers. And this was compounded by their own lack of technological experience. And this is very reflected on the and this became very important to them to be incredibly clear about what they wanted and about having very good quality of communication with the tech designers. But this was also challenging because they themselves didn't really know what they were trying to achieve. And you can see this in the first quote. The next problem was about unforeseen technical challenges, such as syncing their SMS apps to work with different telecommunication networks. And this was experienced by text-to-speak in Nigeria. So this challenge cost them lots of unanticipated time, and because the projects were tightly defined, they didn't have this time. And several of the projects reported these timeframes, which were between about 1 and 4 years, were a constraint, and that the donors were very inflexible about this. So they did not allow them enough flexibility to adapt their technology and to adapt their initiative as they learned through the project over time. So part of this was because considerations around technology, alone were not the only or even the central consideration of the projects. Most of these were concerned about accountability. So as they worked to develop and nurture relationships between citizen and state, the technology was there wasn't enough time to manage that technology. Next slide, please. And I'm going to hand over now back to Tabitha.
Oh,
this is my slide, sorry. Okay, so on citizen engagement, yeah. So moving on now from technology to citizen engagement. All the projects, all 7 of these projects, they were all led by civil society organizations, and they all engaged with citizens in very different ways. So some of them tried to build inclusion into their technology in various ways in order to reach marginalized individuals. Some of them worked very closely with citizens to design the projects through preliminary research. Some of them tried to bring technology to the people who didn't themselves have technology. One of the projects relied on citizen participation through unsolicited SMS messages, and you'll hear more about that in a little while. So this target group didn't know that they'd be receiving texts asking them for feedback on health services. And several of the projects used offline trainings or hosted offline forums with citizens in the target group. Next slide, please. So this is about the most frequently recurring theme regarding what interviewees perceive to work best in terms of engaging citizens through technology was the use of and the leveraging of offline spaces. So there's a tendency to define social accountability initiatives which utilize technology in terms of the technology itself and the online worlds it can create. But what we found in this review of these projects is that especially when working with marginal or vulnerable groups, offline engagement played a huge role in mobilizing people's willingness and ability to participate. So Thuthuzela Voices, for example, was working with survivors of gender-based violence, and this took the form of focus groups and interviews with some of these women. And through this, the project was able to understand what was important to the women themselves and what the women themselves wanted out of the app, while also it was a chance to generate the trust and build trust with the woman and to make the woman feel heard. So this early research ensured that the app was accessible and relevant to the women who would later receive SMSs asking them to evaluate their services, the services they had received. The project also noted that the importance of making women aware that they would be receiving these messages in advance, and they organized for this to happen at the clinics. In another project, Text to Speak in Nigeria, SMS messages were sent asking for feedback on services from pregnant women, but Text to Speak hadn't put much effort into ensuring that the woman knew that they would receive these messages. So when Text to Speak sent late, sorry, I'll start that again. So Text to Speak had a very low response rate, and they later learned that this was in part because the women were immediately suspicious of messages coming from unknown numbers that inquired about their pregnancy. Mobile Mapping for Women's Health in Tanzania sought to bring tech to people who had very little access. So this organization had been working in this community for a long time and had been using paper-based tools, and therefore already had rapport with the community. So they saw this rapport as contributing to what they perceived to be very successful citizen participation. And some of the projects, including Mobile Mapping for Women's Health, also synced their activities with existing offline forums, such as village meetings, and helped to convene additional ones where data from the project could be shared and discussed. Next slide, please. So this is an example from SMS Gateway in Indonesia, and probably this is my favorite example from all the projects. This project mapped itself onto village level forums, which were already taking place, where women, health workers, and other community members discussed healthy pregnancies, signs of risk, and complications. And in partnership with these groups, the team introduced the technology, which was an SMS platform, to the women and their helpers and showed them how to use it. And in this way, the tech became complementary to related health activities that were already happening in the village, and the entire village was already involved in. Next slide, please. Sorry, I'm just waiting for the next slide. So some final thoughts on citizen engagement that emerged from the 7 projects. So the one is the idea that it's probably a good idea to plan for offline engagement, especially if you're trying to access vulnerable and marginalized communities. This is really important. We already mentioned that time constraints were experienced by the projects. Text to Speak in Nigeria had done no prior activities with their target group, which was pregnant women in Nigeria, before sending out this message. Didn't I read this?
No.
Sorry,
Okay.
sorry. Before sending out these messages. And as you can see in the quote that we've got there, they belatedly realized, sorry, you're right, that this was a mistake, and that they didn't, and by this time they couldn't correct it. They didn't have the resources to go back and correct this. And a second point is that these offline activities don't necessarily lead to successful citizen engagement. And we saw this with the Citizen Journalist Health Insurance Project in Bali, Indonesia, where the organization conducted one-off trainings for groups of vulnerable citizens. And they noticed that there was some activity after the trainings, but this very quickly fizzled out. So it didn't sustain itself. And as a final point, successful citizen engagement, whether it's online or off, doesn't automatically lead to change. We don't have any long-term examples to point from, but this is something you observe in the literature. Next slide, please. So I'm going to hand over to Tabitha now.
Yeah, okay, so I'll try and be quick. I'm cognizant of time. Okay, so way back at the beginning of our presentation, we noted the necessity of political will and capacity among stateside actors that would lead them to be responsive to citizen voice. Most of the projects work to build on existing relationships or develop new ones with different actors in the state in hopes of harnessing, triggering, or generating this political will and mobilizing resources among state actors. So depending on the project, these state actors range from state institutions such as departments of health, elected officials and political parties, or other local district or national level authorities, and health service providers at the ground level. Next, please. Where projects had long-standing relationships with state actors and had perhaps worked with them on similar issues previously, they seem to consider themselves more successful, or at least having more potential for success during their MAVC grant period. So Our Health in South Africa, for instance, had been doing citizen journalism since 2012 when it was first piloted with paper-based tools and had been recognized by high-level government actors. Mobile Mapping, which we've heard a lot about, felt that their own relationships with government officials at a local level were key for their own perceived success. Others sought support from state actors they identified as already having political will. So SMS Gateway in Indonesia, for instance, gained enthusiastic support after approaching district-level health authorities as they were already actively seeking to improve maternal health in the district, and therefore the project enjoyed considerable support from them. Thuthuzela Voices also recognize the power of tech to offer new potential for positive reinforcement of health service providers at a very localized level, which they recognize as a tool to sustain positive behavior patterns. So positive feedback, essentially, is also recognized. Slide, please. Maintaining or trying to build state relationships was by no means straightforward, and all interviewees reported challenges with this. For one, relations within the state complicated accountability activities as different relevant state actors didn't necessarily see eye to eye or have the same priorities. Through focus groups, Thuthuzela Voices learned how important it was to the women to be able to rate police. However, the Department of Health and the NPA, with whom they were primarily working, didn't themselves have an easy relationship with the police, and they felt uncomfortable passing along highly negative feedback, which ultimately meant that the worst services were least likely to change. Another issue included tensions between sympathetic lower-level authorities in one political party and superiors in another political party, meaning that necessary resources were denied. Political cycles were an issue for several projects, with some facing the fact that their allies that they had identified and developed memorandums of understanding were removed from power after an election and no longer championing their cause. So text-to-speak in Nigeria and Etequini Wax in South Africa suffered massive blows due to this. And similarly, changes in national level legislation following elections affected district level budgets. In the case of SMS Gateway, rendering those highly sympathetic district officials unable to continue to fund the initiative beyond its pilot. So all these examples illustrate how challenging it can be to work with a state, and that political will, even where it does exist, doesn't necessarily lead to change. Next, please. So we've got an example here from Our Health in South Africa. It's a good example of the careful management necessary to sustain state relationships for social accountability. So it was designed as a name and shame initiative. The project trained health activists across the country in citizen journalism skills, who then went on to make regular medical stockout reports of their community clinics and write journalistic stories on health issues in their areas. So these reports and stories were regularly published across a range of high-profile and local media outlets. And in order to maintain access to the clinics, Our Health had to secure permission for its citizen journalists through a long line of gatekeepers, starting with the National Department of Health on down through regional, district, local, and clinic level authorities. So in this way, the project is a good example of vertical integration, so enjoying at least some support at multiple levels of the state and across a wide range of actors, and thus was less reliant on just a few sympathetic actors. That said, they had to manage many simultaneous relationships and balance their shaming activities with more constructive forms of engagement with state actors in order to continue. They quickly learned that continually embarrassing the state was not sustainable, as they were liable to get kicked out of the clinics and lose the cooperation of their state allies. So they managed this through a later agreement with the state to share information on stockouts with the government before publishing it, so that would give the government a chance to rectify the situation. If it still hadn't been fixed by a set period of time, then the reports would be published. Slide, please. This is our final slide.
It's up to me to wrap up the final slide. So just to say, there's an awful lot you can do with technology, and there was a lot of excitement, but ultimately none of it matters unless you have productive, trusting, and carefully managed relationships, both with the citizens and the state. And if you take away nothing else, that's our most important sum up point. Thank you very much. Next slide.
Great. Thank you very much, Tabitha and Linda, for the very interesting presentation. And I'm glad that I think we've still got Isabel with us. So I think what we're going to do is, we haven't received any questions just yet. Isabel, I guess you have about 5 minutes or so, is that correct?
That's correct,
yeah.
yes.
Okay. Yes. So our organizers, yes, we can hear you. Yes, your connection seems to be okay now. Perhaps there's a bit of a delay. Okay, at the moment, our organizers are just saying the audience seems to be a little shy today, so we don't have any questions at the moment from the audience. But just listening to those presentations, I have a question that I'd like to actually put to both the speakers, but perhaps if Isabel, you might want to take it first, and then I think you might have to dash for your next appointment. So can you hear me okay?
Absolutely, yes, thank you.
Great, okay. Yeah, so you made a really interesting point during your presentation, Isabel, about using statistics from South Africa government, as it was kind of avoided getting into debates about the kind of the rigor of data and sort of the different indicators. And then I know, obviously, part of the work which is being done by through the health projects is on community-based collection of data. My question to both of you is what do you see as the added value of community-based data collection, and in terms of perhaps the kind of rigor or the sampling, what does it add to those national level statistics that the national level statistics cannot give? Isabel,
Sure.
Would you like to take that first, and then thank you.
Can I just say to Tabitha and Linda, thank you very much. I really enjoyed your presentation, and the question about sort of community engagement in data collection, but also in participation, is something which we felt very strongly about. We can disaggregate data often to a district level. Again, we depended on the data of data collection of Stats SA, but the fact that people statistically agree to the fact that, for instance, they have access to running water within 20 meters of their house, it doesn't give you the subjective level of enjoyment. And so my view is that community audits, the kind of participation that Tabitha and Linda were doing, having in their own research projects using technology where it's sort of accessible, is vital, because it gives you the real story. Again, if you want to go back to the legal perspective of the enjoyment of the right, not the access, but the enjoyment. And we've tried doing that in terms of having a number of community dialogues. But our finding was that you really need to have a longer term project. So you're not just going in and extracting answers to pre-organized questions. Sort of community participation and active participatory research is something which is crucial and comes up with nuances, as well as sort of the kind of glitches in delivery systems that you can't get from survey data. So I'd be interested in hearing Tabitha and Linda on this in my next 2 minutes.
Thanks very much. And thank you too, Isabel, for your presentation, which was really interesting. And I agree with you about you need both. You need both the legal parameters, but you also need the how people experience it. I think for me, the most interesting thing about community collection of data is it also leads to discussions in communities and between communities and health service providers. So for example, in mobile mapping for women's health, they were thinking about what's feasible, what can be done, what can't be done. It wasn't simply a kind of, oh, I don't have access and therefore I should. And so there were discussions with health service providers, and health service providers were made more conscious of community perspectives. Communities were made more conscious of health service providers' perspectives, and between them and together in this particular example, they came up with creative solutions to address the problems. Now, that's not always possible, but certainly that was possible in some of the projects.
Yeah. Yeah, I would also add, maybe getting back, I think the original question was about what was the added value of community-based data to national level statistics. And we didn't talk about this much in our presentation, but the importance of well, there are different types of projects and different models, and most of the ones we were looking at were very localized. But in the social accountability literature, there is some discussion over the importance of vertical integration, which we mentioned. So having recognition and allies at multiple levels of the state, so that information is seen as legitimate in the eyes not only of district authorities who may be restricted because of their funding, their budgets, but also to higher level. And that's really the challenge with a lot of these smaller scale social accountability initiatives. But that's not to discount the value that they can create within communities themselves. So some of these offline forums where you had citizens participating as well as health service providers in the same spaces having these kinds of conversations could make qualitative changes to those services in the communities themselves, whether they're recognized at the top or not.
Yeah.
Okay, thanks. Thanks very much for those responses. Isabel, do we need to let you go now? Or...
I've actually discovered a pocket of unexpected time, so no, I'm here.
Okay, great. Okay, thank you. So we've got a few questions that have come in now. So the first one that's come in is for Tabitha and Linda, and the question is from Paul Rios, and he's asking, Raul Rios, and he's asking, how can NGOs and civil society engage ICT companies to implement projects such as the SMS project mentioned and avoid pitfalls or complications?
Yeah, interesting question. I'm not sure we have a set protocol that we would recommend, because all the projects we looked at had some of them similar challenges, but also quite different challenges. But the main thing seemed to be a disconnect between the types of knowledge that the civil society organization had and the types of knowledge that the tech developers had. And some of them, they felt that they were speaking different languages in a sense. And one thing we heard from several of them was, in hindsight, they would have had much more sustained and clear and concise communication and dialogue with their technical partners way up front in the beginning, just to make sure that everybody's on the same page. That was something that came up several times. You want to add to that?
Yeah, I'm going to answer the question from a slightly different perspective, because I couldn't interpret it in two ways. So the text-to-speak, the Nigerian project, that tried to work with mainstream mobile phone companies and telecommunication services to send out the SMS messages. So engaging those companies wasn't actually the problem in that particular example. The problem was much more making sure that people in the communities were expecting to receive the SMS messages. So, I mean, from my point of view, I think the big challenge that all of our projects seem to show is that they work on small, local, relationship-based arrangements. And this is a challenge with digital technology and mobile health in any case, which is around questions of scale up and how you generate large-scale buy-in. Because all the projects needed close and intimate relationships. So I don't actually have an answer to this question, but maybe some of the viewers have comments and reflections they'd like to share in relation to this.
Okay, thanks so much for the responses. So yes, if anyone does have any their own thoughts The listeners online, if you have any thoughts, please type them in the chat bar, or any other questions. We have another question that's come in from Rupa, who's for the Department for International Development in the UK. This question I will put to all of the panelists. Big question. So what creates incentives for the state to engage and respond to social accountability? Isabel, would you like to take that one first?
Well, thank you. That's a really important question, and I think the answer in that lies in the need to build systemic institutions, because a bad state, a failed state, doesn't have to respond to nice requests for responses in terms of accountability. That's why we at SPIRE have found the use of Parliament to be essential in terms of holding the executive to account. That comes in with its own political dynamics when the ruling party has a majority like we have in South Africa, but it's about making the case for the importance of an independent executive in order to ultimately keep the political party in power, that is the ruling party. So it's about selling that link about democracy, accountability, and political power. In terms of when you use civil society and organized labor, for instance, then the incentive is that the state has a kind of citizenship that is pleased with its progress. Again, in my country, we resort a lot to violent protests when citizens are not happy. And so you almost have the kind of threat there of quite chaotic violence when people are dissatisfied with state delivery. So I think it's multi-pronged. It's both the institutions of democracy, such as Parliament, but it's also about the citizenship and how a ruling party and state feel that they are best served in terms of a happy electorate.
Yeah, I was thinking along the same lines in a sense. I think that's really closely connected to political accountability. So in the social accountability literature, there is this recognition that social accountability works better in places where you have stronger democratic institutions. So where the state does already feel politically accountable to its citizens. If they don't, if they fail, maybe they'll be elected out, voted out. And in those kinds of contexts, something like name and shame tactics might go a long way in terms of making, causing embarrassment in the state or amongst elected officials to be responsive to citizens. I think in the selection of projects that we looked at, they were quite small scale. Most of them were working with more localized government bodies, and I think in some cases there already kind of was political will, which certainly made it easier, and in other cases there may have been just one or two allies. And I think that if you can identify who those pro-accountability actors in the state may be and those allies, it's a slow process. It's a political process of navigating power and building up relationships and a network of pro-accountability actors in the state. I don't think there's any one clear answer, but Linda, do you have something to add?
It's a great question,
yeah.
and not one we thought about explicitly in the course of doing the work, but I'm really pleased to be asked it. I think the first thing is that one of the things our research showed is, of course, and we know this, but it really showed it playing out in practice, is that the state isn't homogenous. And even at a local level, different actors, there were tensions between different actors, and that could be a hindrance, but it could also be supportive. So there was a tension around that. In terms of what makes the state more willing to engage in this, I think political cycles were a real moment of opportunity, and we saw quite a couple of the projects built on the intention of new incoming government actors, so built on political party cycles. But of course, when you hedged your bets incorrectly and things went wrong and your political party didn't get in, that was then much more difficult to then try and work with the opposition. Just thinking through our examples and what I know, I can quickly come up with kind of 3 or 4 reasons why I think states should be encouraged to do this kind of thing and to engage in social accountability. Firstly, it definitely builds better community relationships and relationships with communities. I think it enables, and some of the examples show this, it enables more creative solutions than the government can come up with on its own, or certainly that beleaguered health system service providers can produce when they have to produce the solutions by themselves. I think it can go a long way towards facilitating local ownership, and it also goes quite a long way towards helping communities have more realistic realizations of the constraints and of the challenges. The stories Tabitha gave about, you know, local drug stockouts. Originally, the problem was just they weren't drugs, but once the citizen journalists started exploring them, they started to realize how difficult the process was, needing to make sure drugs were in date, challenges between getting drugs to the storage depot, getting them onto the shelf, getting them registered. You couldn't just have drugs everywhere and anywhere. So they become much more aware of the fact that governments aren't just simply deliberately being resistant to providing services, but actually that there are procedures and processes that go alongside that aren't always automatically easy to resolve.
Okay, thank you. Thanks a lot for those very clear responses to that very big question from Rutha, an important question for the social accountability relationship. We have a few more questions coming in. There's a couple that have come from Yub Basnet in Nepal. I'm sorry, Yub, I don't quite understand your first question, but perhaps you could try and explain it again and send it again in the chat bar. The second question that Yub has is about public audits and the potential for using public audits as a social accountability tool. I think that's what the question is, but he says, in many instances, there are limitations of the people's awareness about their rights. So what's the kind of potential for public audits when people have, or perhaps social accountability initiatives when people have quite a low awareness on their rights, perhaps what the kind of, you know, what their legal rights are. So that's, yeah, there's quite a few questions in one. So perhaps if you could sort of, it would be great if the panelists could answer that first question around how do you create kind of people's awareness of their rights, and that the relationship between building people's rights and empowerment and the social accountability, their involvement in social accountability processes. Thank you. So I think Isabel seems ready to go.
Thanks. Just very briefly, I mean, this is an incredibly good question, because one often assumes if you work in the rights field that knowledge of rights is kind of universal, and it's important not only to realize that many people are completely unaware of their rights, but also what a right means. So for instance, if you go to the clinic and there's a stockout, there's no medication, there's a very strong distinction between thinking the state is not doing its work by giving you medication and the position that your right is being violated, because the latter, of course, gives you far more power. You're a right holder as opposed to a recipient of state duty, which is being given or not given. So in terms of social audits, because we don't use ICT, we'd love to move into that, but currently it's much more immediate face-to-face. And so in the process of an audit, to actually have a rights awareness component to their engagement is necessary. And of course, that really should be an ongoing process where you go back to communities rather than just, again, the jump in and extract, which sadly some civil society organizations do, because the awareness raising needs to be part of an ongoing project sort of across the country, whether it's in schools, etc. But it's not very worthwhile to ask questions in a language and framed in an assumption that isn't shared by the people that you're engaging with.
Do you want to? Okay. in our projects, I was just thinking, I think there are 3 ways that the different projects approached this sort of awareness building of people's rights. The first way was through direct training. So these were sort of smaller scale initiatives whereby they brought people physically into spaces, or they went into the spaces where people already were, and spoke to them there, and developed relationships within the community, and to kind of create spaces where knowledge on rights could be shared and discussed. There was the second approach was through indirect information and education, and I'm thinking specifically here of the Our Health project in South Africa, whereby they had these trained citizen journalists who were already sort of identified as activists in their communities around health issues. And so these journalists were then writing stories about health issues in their communities, and these stories were getting published in a range of different media outlets in different languages, small publications that would reach small numbers of people, radio spots even, they were starting to move into radio spots, and even nationally syndicated papers. So that was sort of the indirect approach of reaching people. And then some of them did no training whatsoever, or made no efforts to kind of communicate to people about their rights, and it wasn't necessarily because they didn't want to. I'm thinking specifically of Text to Speak in Nigeria. They kind of had their whole project model thrown out because they had relied on support from a political administration who was elected out of office, so they had to recalibrate really quickly. They didn't have enough time to sort of redesign. And so they just sent out these text messages to people who had accessed services, and they got a very low response rate. So I think different ways of doing it depending on the projects, depending on the context.
So I think Isabel, I think what you said is really, really interesting, because I mean, I need to go back and double check, but I don't think many of the projects spoke in terms of the language of rights. I think our projects were much more concerned around health service delivery and how do we make health service providers be more engaged. And many of the problems that the health service providers were experiencing weren't necessarily their own problems. They were created by higher up in the health system. But the debates and the discussions were very much focused around how do we create a system where people get better health provision. And so, although underlying that and behind that is debates around rights, and maybe social accountability initiatives should look more at rights, and maybe it could have been more explicit in these projects. And it's an interesting question whether that would have produced better or different results. But I don't think many of them were framed with that approach. They were much more around how do we help people to get appropriate health services.
Yeah, thank you. Thanks a lot. And it's really interesting what you're saying about the health services being not so much focused on rights, and how that kind of interplays with the citizens' voice, or how whether they feel that they can actually raise their voice. It links very well to a question that just came in from Leon Muoni. I'm not sure where he's based. But he was saying that if citizens don't see their be it social security benefits or whether it's health services, if they don't see them as entitlements, then they may feel powerless to raise complaints. So I think that's something that is very common in social accountability projects. But his question was actually, does technology help to perhaps go around that problem? Is it a little bit more anonymous? Does it help people to raise their voice where they might not normally raise it? Yeah, so his question was to Tabitha and Linda was whether you, through your research, you found any examples of that where technology helped people who might not have spoken up in a kind of in if perhaps a face-to-face situation. Do you think it helped them to be able to sort of raise their concerns or raise any issues they had?
Yeah, definitely. I think we do talk about this in the paper a bit, but the issue of anonymity was really important in, for instance, the Thuthuzela Voices project, where you had very vulnerable people, women who are accessing health services related to rape and gender-based violence, and so the issue of anonymity was very important, and I think that kind of thrusts into on center stage the importance of trust. You know, citizens have to also be able to trust that the information that they're giving out is going to be kept safe, that they aren't going to be nobody's going to know that they posted that information. And in this particular project as well, because the numbers of people accessing these services is actually fairly low. So they had, what the organization did to deal with this was to wait until they had a sort of a critical mass number of responses or pieces of feedback before they were then given to the health service providers or the other individuals who they were receiving feedback on. So that kind of helped to preserve the anonymity. But yeah, the trust building was really important. And in this project, because of the very sensitive nature of what these women were accessing in terms of health, the sort of early work that the project did with them in focus groups to kind of figure out exactly what they wanted out of the app, what kinds of security they needed, generating their trust, what they felt women down the line who wouldn't be in the focus groups would need to be able to feel comfortable using the service. So certainly those are questions that are important to consider when designing any kind of social accountability. And it can, yeah, I mean, I think tech can absolutely play a role in terms of fear or reprisal. Okay.
I think, thanks very much, and thanks, Tabitha. I think technology can do both. I think it can help create anonymity, I can't talk today, and it can help people to be more responsive, but it can also appear as incredibly anonymous. It can appear as the state observing people. It can appear as invasive. So most of our projects have people who responded with the technology, and technology certainly made things easier. But in the cases where the responses were positive, there was almost always training, face-to-face stuff happening as well. In the case where we had just technology, people were suspicious. People didn't know who these strangers were who were communicating with them, and didn't respond. And I think that we need to be really careful not to assume, and you know, there's a lot of buzz around technology, mobile phones, mHealth is seen as a very, very positive thing. It's going to revolutionize the health system. We need to be very careful about not assuming that the technology automatically does it by itself. The technology is a tool and it can work in both ways. And probably one of the dangers is that without engagement, we have no way of knowing how people experience and interpret technology. So I think technology can be an enabler, but it can also not be an enabler.
I think there's also another issue under the surface here, just very quickly, but when you're working with private tech developers as well, you're introducing a whole new set of actors and a whole new sort of black box around the protection of data as well. And I think that's something that the literature hasn't quite caught up with, research hasn't quite caught up with, yeah, how do citizens feel about their data being stored by private, you know, sometimes for-profit corporations, companies, but that's a whole other thing.
I've seen that in the UK on Facebook.
Can I just come in there? And I think Leon's question is great, and I've been interested in the previous conversations that are tech-related. Because the kind of last response I think was very valid. From our perspective here in South Africa, the question of reprisals and effective complaint mechanisms are crucial. And if one looks at the very sort of nice theoretical human rights approach to sort of socioeconomic rights enjoyments, not only does it emphasize the rights holders' rights, but also the duty bearers' obligations and the need for the duty bearer to be aware of it. So what we find on the ground here in South Africa is that many of the officials are unaware of the concept of rights themselves. So the kinds of dismissive and rude and aggressive attitudes that people get in clinics or sort of home affairs trying to apply for passports, etc., is indicative of the fact that civil servants often view themselves as being the holders of all power. And if you do question that, you just don't get served. So that's where the direct reprisal comes in. One of the tools that we have, again, in South Africa, thanks to the Constitution, is the right of administrative justice, which is legally protected in Promotion of Administrative Justice Act, which is meant to, again, set out ways in which people's rights to have reasonable administrative justice meted out, which includes sort of access to services, is meant to be regulated. But again, I mean, let's be honest, in reality, if people are virtually unaware of the rights that they hold, then the remedy for any rights violation is something which is even further down the road in terms of that. So just in closing, I think, again, the difference between a rights holder and a customer is also important. It's always with concern that I notice when certain government departments start referring to customer charters, because rights holders are not customers. They have an entitlement, and they need to be they need to be strengthened in how that gets realized, and also the action that gets taken against officials who don't respect and recognize that right. Thanks.
Okay, thank you so much for coming in there, Isabel, and then talking a bit more about reprisals, or the fear of reprisals amongst communities or people who would want to make some kind of raise their voices about some kind of issue in service delivery or in relation to their rights. We only have a few minutes left, and there's a question from which I'm not completely sure it's been fully addressed, from Barbara Rohriger, and she's asking, she agrees with what Linda says about, so I think that was a little further back in the conversation, because a bit of a time lag on how quickly the comments come in, and the process of answering them, which is one of the joys of working through a webinar, the joys of technology here. So her question was on, so this is not just about technology. So these projects are not about technology so much, but they're about accountability. But then what are the actual expectations towards technology in improving the accountability processes within these projects? So kind of how important is the technology seen within these projects for improving accountability? I think we've touched on that a bit, but perhaps you might want to elaborate a little more to Tabitha and Linda. Thanks.
Yeah, I think it was different among the different projects. So what we didn't mention was that Making All Voices Count funded projects for different reasons. So some of them were called, some of them were classified as innovation projects, so they were completely new things. Some of them were scaling projects, in which they were already initiatives that were already functioning in some way, and they wanted to kind of scale up. And I can't remember what the third one was, but in any case, some of them were already working with well, not even necessarily tech, but they had paper-based tools. So for instance, the citizen journalists in South Africa were already, this project has been going on since 2012 using paper-based tools, and so the technology kind of came later. And I think that the project implementers sort of saw it as a way of oiling the gears, if you want to call it that, making things a bit more quick, a bit easier, and I think they did experience that. For those that kind of started with nothing or from nowhere, the technology seemed, they were more excited about the technology itself and what it could do. And so I'm thinking of the citizen journalist health insurance scheme in Indonesia as an example, whereby they assumed that, okay, if we just show people how to use social media and give them a little bit of rights training, then the technology will, and they were very much focused on this kind of training, how to use the tech, rather than the sort of relationships that need to be sustained with not only citizens but also with government actors to kind of ensure that the government actors are listening, that they have the incentive to be responsive, etc. So I think expectations were different depending on the starting point from each project.
I think the question of how important technology is partially depends on who you are and where you sit in relation to all of this. So in the conventional literature around mHealth, mobile phones and health and technology, there's massive enthusiasm that technology is going to kind of somehow magically cut the Gordian knot and solve all the problems. But that's not actually what we see. And I think the question of how important technology is has to be, what do we think technology can do and how will it work? So in the eThekwini Wax example, for example, the idea was that citizens and members of government would communicate through technological applications. But actually, while citizens were happy and willing to use those applications, the members of government weren't. So how important is technology in that example? It depends who you are and where you sit. But in terms of making it work as a social accountability program, in that particular example, it didn't. I think we have to be really careful not to see technology as something that's going to magically cut through difficult political and economic decisions and choices and negotiations that have to be made.
Yeah, absolutely. I think that this centrality of power relations and the different amounts of power between different actors involved needs to take center stage. And all the excitement and the hype about technology, you know, we need to bring ourselves down to earth and realize that it's about relationships and how can technology be used to enhance relationships, which should be the central concern. And I think in general, we've all kind of seen in development spaces how excited people get about technology and how it's going to revolutionize things, and we get a bit distracted from the low tech stuff that's really, really important.
Okay, thank you so much. I'm afraid we have run out of time now. We've had some really interesting discussion, really interesting presentations from our panelists, Isabel Frey, Tabitha Hrynik, and Linda Waldman, and some really interesting questions that have come from the online listeners. We did have 2 questions that I'm afraid we've run out of time to answer. But what we have done with our previous webinars is we have compiled the questions and answers into a document that we can put onto a page of the website, along with the recording of the presentation and also the slides as well. So you'll be able to access them, and we'll be able to answer those questions which we were unable to answer in the time. Yeah, so thank you everybody for participating. So for our presenters and our online listeners as well. And yeah, as I mentioned before, we all the recordings and presentations of all the webinars, they can be found on the virtual campus, or you can access them via the social accountability community on socialprotection.org. And you can also register for the social accountability community on socialprotection.org, where if you register, you will receive updates when new resources come in. And just for the social protection team, you can also follow them on Twitter, Facebook, and YouTube. And thanks very much to our organizers online. So to Yannick and Corinne, who are silently supporting us from Brazil. So thank you very much to our panelists.
Thank you very much for the opportunity. It was really fascinating hearing Tabitha and Linda as well.
Yeah, thanks so much. Yeah, we really enjoyed it.
Thanks so much, everyone. Have a good day.
Thanks, Alice.
Thank you. Bye.
Thanks. Bye.